Welcome to The Bone, the podcast that goes deeper. Here we cut through the noise and get straight to the core of the issues that matter. From real stories to raw truths, we dive deep into the conversations that shape our world and challenge our thinking. We're not afraid to dig in and get to the marrow of it all. Whether it's life, culture, or business in sports medicine, we're here to break it down raw and real. No filters, no fluff, just to the bone. With your host, Shelby Daly, we're getting to the bone. This is a clinically pressed, approved CEU podcast. Find the quiz to gain credit at clinicallypressed.org/courses. Clinically Pressed Company, making the complicated simple through results that give back. Find out more at clinicallypressed.org. Let's get started.
Welcome back to the Bone. Today, we will be talking more about some business and opportunities for athletic trainers. Today's guest is Alicia Yamamoto, founder of Concierge Athletic Training Network, or CATN. This was created to connect patients directly with athletic trainers, providing concierge and private practice services while helping athletic trainers build visibility and grow independent business. So for decades, athletic trainers have been viewed primarily through the lens of athletics, schools, and sports teams, yet many athletic trainers possess extensive expertise in musculoskeletal healthcare, injury prevention, rehabilitation, and performance enhancement. CATN is challenging the traditional model by helping the public access athletic trainers directly. So today we'll discuss CATN, why it was created, and what gap in the market it's trying to fulfill. So welcome to the show, Alicia.
Awesome. Thank you. Thank you for having me.
Yeah. So let's get a little bit better background on you as an athletic trainer and what led you to building this platform.
Yeah, I am an athletic trainer through and through. I did my bachelor's, master's, and doctorate specifically in athletic training. I've worked in a lot of what's considered non-traditional settings within athletic training. So I've had quite a bit of variety within the profession itself. But, my roots are athletic training, and that's what I've been practicing for 13 years now. So I went to my undergrad at Indiana University, and I did my master's at the University of North Carolina, and then I did my doctorate through AT Still University.
Nice.
Yeah.
And currently, where are you at? Where in the world are you, and what are you doing for your practice?
Yes, currently I am contracted for a tour. I'm contracted through a company called NeuroTour to a company called Riverdance. It's an Irish dancing performance show, and I'm on tour in the United States with them. We're doing 67 cities in 5 months, so we're moving quite a bit. I actively am in San Antonio right now, but won't be for much longer. I personally live in Las Vegas, and I first moved out there in 2021, and I started there, left for a little bit, came back, and that's where I am when I'm not here. And that's where I started growing my own business, Yamamoto Wellness. That's where I, went off on my own and started my own thing, and I'm still actively growing that as best as possible while on tour. But once I finish here in June, I'll go back there and keep growing there.
Nice. So being on the road, obviously you need to be prepared for your patients, your athletes, your dancers. But on the road, sometimes some people get left behind due to injury or all that type of stuff. So having a network of other people to help you is quite important.
Yes.
Can you give a little bit more background on that and maybe how this led to you on building this platform?
Yeah, so honestly, I've done a few different types of tours. One was a drum corps tour, one was a circus tour, and now this is an Irish dancing show. And I've done international and domestic, and some of the root problems are the same amongst all of that. And it's honestly, I don't think just touring, like some of the root problems in healthcare in general is just direct access and getting access to the care that you need in a timely manner. And I've seen that now in many realms, in many jobs, in many capacities. It's just this in particular is a little bit different because it came from me personally having an injury and me needing access to care and not being able to directly find that and coordinate that for myself. I was traveling for work and I had a mid back injury that I felt was very specifically like a spine rib dysfunction type injury. And I was like, I need an athletic trainer. And this happened, of course, on a Friday, of course, going into a weekend, of course, in a city that I didn't actually know someone personally. And so there was all these variables that are working against you in those situations. And I, as someone who's highly educated in this profession, knows what I'm looking for, knows what I'm seeking, knows what I need. I couldn't find someone directly on my own to be able to help me. And that's extremely frustrating. And that's someone who, I know what I'm looking for, right? So I can't imagine, people who don't know that these are options, because there's a lot of people out there, of course, that don't even know what athletic training is. So that's a whole nother advocacy issue that we have in our profession in general. And so, for me, it was designed out of a solution for my own problems. And I just wanted to put on, wouldn't it be great if we just had one central location where we can look up in our area people who might be available to connect with on these off hours and in these last minute times when injuries come up, because that's the thing is people need help when they get injured, and you can't really plan for those things.
Yeah, definitely. And so when you were envisioning this or running through this problem that you were just searching for someone, how did you go about that? Were you just reaching out to your friends to see if they knew anybody in the area? How did you solve that problem at the end of the day?
Yeah, so I first I did my own Google searches, of course. I was trying to look up any clinics that might be open, and I was looking from a variety of physical therapy clinic, massage therapy clinic, chiropractic clinic. I'm just kind of looking what might be available to me, and literally nothing was available. It was the clinics that were open, they were just booked solid, or they took insurance that I don't have, or it was someone that I didn't really believe would understand the specific thing that I needed. And I didn't want to just go anywhere just for the sake of going. And so I ended up reaching out to one of my friends who's been in the concierge space for a while. He's an athletic trainer in the concierge space. Not in the town that I was in, but it was a city nearby. So I just asked him, do you happen to know of anybody in this area that also does concierge work? And he was able to reach out to, he did a lot of effort. He reached out to 7 or 8 different people who were trying their hardest to make something work, and ultimately one person was able to create some space in their schedule and help me. And I'm just so deeply grateful that I had a network to lean into and people who really empathized for the situation I was in and wanted to find a way to help me. So that was a very beautiful aspect to see of it. And also I felt, it's just not necessary. We should have something in place that you can take agency over your care and what you need and how to find it. And so, yes, I'm very grateful for that. But also I felt this isn't a situation that's unique to me also. If I'm having this problem, someone else is having this problem. I'm just a human, just like anyone else at the end of the day. So if I can do something to try to improve the situation, then I'm going to try at least. And so that's, where that came from.
Yeah. So while you're developing this idea, what surprised you the most while creating this or putting it together?
It's interesting to me how quickly people have responded to it. Where, I just put this out a week ago thinking maybe just my friends will look at it and be like, oh, that's a neat website. But I have almost 30 people registered as concierge athletic trainers on the site already. And it's been 1 week, and I've had quite a bit of people reach out and direct message on LinkedIn and stuff, just being like, hey, this is really cool. And then they just want to share, this is the business that I'm doing, and this is what I've been trying, and this is, the problems I've been working through. Do you have any insight? Do you have any advice? And it's been really cool, just the community building aspect of it already, which I was just working on a project that I was going to share with people. So that's been really cool so far.
Yeah. So if you could summarize the platform, just to make sure everybody's clear, How is this supposed to work, and what is it doing in general?
Yeah, so this is a platform designed for, it's a searchable directory is all it is. It's not a referral, it's not a recommendation, but it's a searchable directory that the person seeking care can look for an athletic trainer in their area, wherever they may be, or they can look from specialty as well. Both of those aspects were obviously important in my story and my journey and my process. So that was the root of the directory itself, to be able to search for someone who is in your area and can focus on what you need them to focus on. And so the platform is designed for two parties: one, the client itself seeking care, and then the athletic trainer who's in business trying to grow their clientele and increase their visibility, and promote their businesses.
Yeah. So I guess, is there like a membership fee, or is it just free access? How do people access it and gain access to the athletic trainer, or vice versa?
Yeah.
How does someone sign up?
Yeah, no, the registry itself, everything is free. For the client to use the website to search for people, and for the athletic trainer to register their information, all of it is free. And that's a very important intention of mine when it comes to the value of access. And also, just as a, athletic trainer that's been in the concierge space for a couple years now, having free opportunities to promote yourself, to promote your business, to build your SEOs and your online presence, like, it's an extremely valuable thing for you trying to grow your clientele. So right now it's free, and I would like to find ways to keep it free if at all possible.
Yeah, definitely. So I guess SEO is a big thing. Trying to search how to get it.
Yes.
I know, doing per diem work, because this is separate than that. These are athletic trainers doing private client treatment, the concierge, as used in the title. It's not necessarily the event coverage, being assigned to something, being there for a set amount of hours. It's getting in, doing the treatment, evaluation, getting out. So with this, oh shoot, where was I going with that?
SEOs.
Yeah. So I guess, how are you doing search engine
Yes.
getting the search?
Yes.
Yes. How are you getting people to find this? Are you strictly saying athletic training, sports medicine, injury evaluation? Like,
yeah, so
have
I'm
you
glad you
figured that
asked
out?
that. Yeah, because this was actually very intentional, because I was, my first website that I've ever put together was my own business website, and quite frankly, like, it did not grow. It was not doing well. Like, I didn't know any of these things at the time. Now that this is the second time around, like, okay, there's some important factors that I need to take into consideration when how I want to market and promote something. And for me, it's really not about targeting athletic trainers in these search engines. It's more about targeting the client, because athletic trainers, we've got a tight community. Like, people who are in the concierge space and athletic trainers are going to share this with people. They're going to promote it. Like, they understand it intuitively, and
Yeah.
I feel like, more naturally going to grow in that community. But the people, the clientele, like, they don't necessarily know what they're looking for. All they know is that they're in pain. Like, they're in pain, something happened, and they need help. And so I did a very intentional dive into what are the most commonly searched, terms, and what are the most popular high value SEOs to attract the person that's looking for someone, because we have to find a way to reach the people who don't even know that they need us. So right now the website is actually very wordy for that reason, exactly, because I'm from the beginning, like, I have to find a way to draw people to the site, right? And I have to try to find a way to build those SEOs as quickly as possible, so it will start popping up, for when people are, like, researching back pain, knee pain, all the chronic pains that we're seeing most commonly in people in the orthopedic world right now.
Yeah. Well, and that's why I had brought in that per diem portion of it, is when I've had to schedule events before, trying to search for athletic trainers was very difficult, first off. And then, trying to find athletic trainers that maybe have their own business, if they're doing event coverage, all that type of stuff. That doesn't really exist. And I don't think athletic trainers, if they do have their own websites, have done a great job with the SEO and trying
Yes.
to draw people to their website. So that's why
Yeah.
I wanted to ask, like, how are you approaching that and making sure that people can find you?
Yes. Yeah. The athletic training component, I feel like, if you're an athletic trainer now and you're looking for a concierge athletic trainer, you're going to be able to find it because it's built into the title of like, it's the concierge athletic trainer network, right? But people, when they're in pain, they're not going to know to search athletic trainer. So it's not
Mm-hmm.
going to build much from that capacity. So that's why I've kind of leaned more in that direction. I'm obviously like, I'm just seeing how this goes. I can make changes as we go along, but that was just kind of my mindset going into the design.
Yeah. So for the athletic trainers that sign up to promote their services and location, are there any qualifications for them that they need to provide when they sign up, like a BOC number or licensing number or any of that
Yes.
type of stuff?
Yes. And so I specifically made it that in order to submit to have it reviewed for approval, you need to provide your active BOC and license number if your state requires that licensure. I have a lot of
Mhm.
liability and verbiage on the site saying that people should, also investigate this on your own. If you're going to hire someone, know who you're hiring, look into them, look into their licensure, of course. But, for me, it was very intentional that like to show, the advocacy of the profession too, right? And the licensure and the
Mhm.
status of the profession as well. So having that information is required to submit the website. You don't have to provide, if you're not set up as an official business entity, like an LLC or anything like that, you don't have to provide that, but you have to show that you have an active licensure and certification.
Yeah. And then what other information is put up on the website, like a profile, a resume? You said something about
Yeah.
specialties. How does that all lay
Yeah.
out?
Yeah. So right now it's set up that you provide that information and then you can provide your years of experience. If you do specialize, because some people, athletic training is growing a lot. So there's a lot of
Mhm.
niches out there now. So if you have a specialty that you really resonate with that you want to promote, you type in a bio for the profile itself on the website, and then you can provide your links to your own business website, your email, your phone number, your social media, whatever it is that you're using to build your online presence. I wanted you to be able to input on the site because it will also help you then build your SEOs of your businesses, because the more things are linked, then, the more things crawl and then they grow, and any opportunity to get your business out there in the digital world is valuable. And so that's also an option of things that you can add.
Yeah. So you've been up for like a week.
Yeah.
As of June 17th, 2026. I mean, I saw you post on LinkedIn and I was like, this is a great thing. I want to talk about it. What are the trends that you're seeing on the website right now? Is there certain hotspot locations for patients looking for people? Where are people really grabbing onto this as athletic trainers and signing up for your website? Is it
Yeah,
too short of a time
yeah,
to
I think it's both. I think there is something I'm seeing, and also it's probably a little too early, but as of right now, I have 4 people registered in the state of Pennsylvania and 4 in Texas. So that's the most. We've got, I think
Yeah.
it was like 20 states total, but for whatever reason, there's just the most in those areas. But also the more interesting thing to me is that the majority of the people that are registered on there are people who have been in practice for 10 plus years. Like these are
Mm.
not inexperienced people. These are people that have been there 10 plus years, 15 plus years. So people who have kind of surpassed that first round of like the normal attrition we see in the profession. So I thought that was very interesting to take note of for sure when I was looking at it.
Yeah. So with the mission of why you had built this platform, where do you think like traditional healthcare is failing on what an athletic trainer can provide in concierge health?
Well, I think part of the problem is just athletic training was never designed to be traditional healthcare, right? Like, athletic trainers have always been separate from the traditional healthcare model. So like the traditional healthcare model, that's where physical therapy was born. That was where chiropractics were born, but athletic trainers were born in the athletics model. So, the traditional model doesn't support things outside of its model, right? Like, and obviously that's why we've made huge efforts to try to evolve things and get recognized in the healthcare system and all of that. But, I think athletic training in general is just a niche industry. And when you do something different, people don't understand it. Like, that's just, and it's not just athletic training, that's in anything. If you're doing something different, if you're trying to like make something different or be innovative or lead in a different way, people don't understand it. And so creating visibility for athletic training, I think, is extremely important, because if you don't, the general population wasn't designed to see us. We've always worked in these very privileged niche communities of sports and athletics and performance, but the general population doesn't get to see us there. It's just those populations. So creating visibility in healthcare models, traditional healthcare models, if we're asking and seeking support from these models, we have to create visibility through them. And that's, that way more general population people can see us. And so the concierge space is a really cool space because you can work with whoever you want. And we're living in a world right now where like traditional insurances and traditional models, like, it's not working. Like, people are frustrated, people are looking for different options, people are willing to take different routes, and now we have access through everything on the internet and social media. It's like now people have the access, now people have the desire. And so the concierge space, I think, is really cool because you're creating that visibility in the general population, if that's what you're choosing. I know some people are still seeking these niche populations, but it gives you your own platform to create that visibility for yourself. And I think that's very important if we're looking at trying to evolve our expertise as athletic trainers to more than just the sports world.
Yeah. Well, and it's always been like that weird question in my head is, obviously emergency rooms and urgent cares are the public health support for, orthopedic injuries for the general public and stuff. But then the emergency rooms open 24 hours, 7 days a week. But then it gets overwhelmed with things that don't necessarily need to go to the emergency room. But then the urgent care is like, 9 to 5, not a 24-hour thing. So, overloading the healthcare system it's inevitable because the hours of operation don't really work with the resources that are supposed to be utilized because it's not open all the time. And I don't know how athletic trainers haven't necessarily made it into urgent cares more readily, but I feel this kind of connects that missing piece to public health too, is that concierge health. I'm going to come check it out to make sure you do need to go to the emergency room, or it can wait till Monday kind of thing. So I think it's great that we're providing more accessibility with these types of platforms. So good on you.
And I think that's the thing. I think this is kind of an unpopular opinion, but I think that is for better for worse, the value of an athletic trainer is our accessibility, right? Like, because when we're in-house with these teams, yes, it comes with a burden of you're on call 24/7, like the boundaries are crossed on like your work-life balance and how much access you have. And also though, those are the times that make you valuable when you're exactly what you're saying. Like, that makes us valuable to the healthcare system of like, we're triaging things and making best recommendations on like, what do people really need right now in this moment, in the next week, in the next 2 weeks, in the next month. We're like that frontline triage. And so at least in this capacity, if you go off on your own as a concierge athletic trainer and you're listed on this website, you can choose to say no, right? Like, if someone reaches out to you, like, you have the option, and it gives you the agency and the choice to be like, yes, this is worth changing my schedule, altering my plans, or it's not, and that's up to the individual then.
Yeah. So if somebody was just learning about this, they've never done concierge athletic training before, what types of tips and tidbits would you give them for the athletic training specific things? and then probably the business side of things to make sure that they're protected.
Yes. So from the athletic training side of things, I tell this to people all the time, like invest in your own concierge services. I, as an athletic trainer, have personally hired an athletic trainer before. I've personally hired a massage therapist. I've personally hired a chiropractor. Like I seek care, and I know, like as a patient, what I feel good about, like the money I felt good about, and the money that I've been really upset I've spent on. And it gives me a lot of value as a clinician then, because yes, it comes to like your clinical skills, but also, there's so much more than that. Like, did this person as a clinician really hear me? Did they try to understand my story, or did they just try to diagnose me and throw a solution at me? And so I feel like if you really want to go into concierge work, you have to understand deeply that what these patients are looking for from a consumer standpoint. And if you're not used to receiving care, if you're not used to paying money for services, then I don't think you have a full appreciation for the consumer and the business side of that type of relationship in the concierge model specifically. Because when you work in house for a team, there's, different responsibilities, and the team is receiving your service for free. Versus, I
Mm-hmm.
mean, I know that the organization as a whole is not right, but the team is receiving it for free. So it's a different relationship than when you're one-on-one in the concierge space that I don't think people inherently think about before they go into that. From the business side of it, I personally like there's a lot of information out there. I think a
Mm-hmm.
lot of people can do good research on like looking into your liability and looking into, you know, AI is a very useful resource, but I personally just felt better hiring a lawyer in the healthcare space. When I was starting out, I'm like, it's just, I'd rather put the money forward now to just make sure like my I's are dotted, T's are crossed. Like I just felt better working with someone who has experience in this space specifically, in the concierge healthcare space. I know it's not for everybody, but that's just personally what I did, and that made me feel better and more confident about starting to put myself out there, starting to promote myself, and really starting to advocate for myself out there.
Yeah. Well, and I would definitely recommend if you're entering this space, making sure that you set up an LLC business,
Right. Yeah.
entity, and making sure you have your liability insurance. Like you're on your own in this
Yes.
space, really. So you need to
Yeah.
make sure that your I's are dotted and T's are crossed, like you were saying.
Yeah.
This isn't per diem where you're working under another company where they might cover you or you're not. You, as an athletic trainer, you do need your insurance coverage. I will say that
Yes.
flat and clear. There's still
Yes.
confusion around that. So,
Yes.
um, I mean, I think we're pretty good in not getting sued all the time, but you never know, especially when we're
You
going
never
into the
know.
public
Yes.
realm.
Yes. You never know.
Yeah. And I guess from the athletic training portion, you said, this is very professional interactions. Like you were saying,
Mhm.
like in the
Yeah.
athletic department, like, yeah, it's kind of, you know, you're the
Yeah.
socialized healthcare. That's their only option.
Yes.
For this, you don't know who's going to come through your door or approach you on getting services. So,
Yes.
it's being aware of that when you are possibly going to somebody's house to do treatments or evaluations and stuff. How are you going to make sure that everything is very professional and you're not crossing any lines and making sure you're communicating effectively?
Yeah, and I think the most important thing with that is like you're asking enough questions to the consumer that you're managing the expectation at hand. Like, what is it that they are seeking, and what do they need to get out of this experience? And can you effectively provide that? And so before I ever agree to work with someone, I'm doing a free call or a free one-on-one of just like, what is it that you're looking for? Do you even know what you're looking for? Because a lot of people come to me saying like, I know I want this, or like, and then the more I talk to them, the conversation starts to shift where I'm like, I don't think you really want someone like me. I think you want someone that's more analytical, like more the biomechanical, more the, sports science. And I'm not that person. And I'm not going to sell you my service and my product, because that's not a good relationship for either one of us. And so putting it on the front end, making sure you're asking detailed enough questions about truly what it is that they're looking for, and can you be honest about whether you can deliver that or not, I think is very important before you ever go to someone's home, before you ever agree to take on a client relationship, because you've got to find ways to manage that expectation as proactively as possible.
Yeah. Well, and I didn't put this in the list of questions I sent over, but how do you determine the cost? You don't have to give an exact number or anything, but
Yeah.
how do you kind of calculate what a session would be with somebody? Is it a standard rate? Does it fluctuate depending on what the patient wants? Like, how do you determine that? Because I don't want this great concierge health thing get watered down by people that don't know how to set pricing.
Yes, I think that's a very complicated question. And I love that you
It
asked
is.
that because there is no perfect algorithm. There's so many layers behind it of like, what did you personally financially invest into this? So, how do you get an objective return on your investment versus like, what do you have to offer from like your experience, and how does that like then translate to your worth as a clinician?
Yeah.
And what, like, it's so complicated, and I wish I could say I had a really clear system on how I did it, but I had to do what felt right to me too. Like, I did my market research on what I could possibly research on. Obviously, like we've said, researching athletic trainers in the concierge space is a very difficult thing to do. So to be able to look up athletic trainers in your area with your relative experience and your relative background and what they're charging is very difficult. So you have to find something relatable, right? So I looked at what are physical therapists charging, what are massage therapists charging, what are chiropractors charging, to just see in our sports medicine world, what are people offering in my community, and how do I find a balance that really resonates with me. So first it was the market research, and then I had to figure out what was I comfortable with charging when I first started to where I'm in now. Like, when I first started, I was not comfortable charging the highest end range of what was found in the market in the area, because there's a level, like, yes, I'm an experienced clinician. I've been licensed for 13 years, but I'm not experienced in this concierge space. And like I said, like, that relationship is very different than a team oriented relationship. So I had to feel good about, like, I know I'm getting what I feel like is worth my time to do these off hours, these in homes. Like, I have to travel my massage table, I have to pay for parking at the casino. Like, I have to make sure I at least get my return on my investment, but what's going to make me feel good about my time, and also, the experience that I'm bringing to the table. And,
Yep.
that, I think that's different for each person and their values and where they, their experiences.
Yeah. Well, even the administrative portion of it too, of making sure that you're scheduling people correctly, that I can't even think of all the administrative stuff that you have to do. There's taxes,
Yeah.
invoicing, taking payment, managing
Yeah.
your supplies. There's many layers to actually working your own business.
Yes. Yeah, and you're keeping track of all those things, right? For all your tax write-offs, like your distance, your travel, like all those things, and you don't know. Like, when you're starting, you just don't know. So you've got to just do some research and do the best you can, and it can change. Just remember, like,
Yeah.
you can change. And what I charge now is not what I charged then. And, oftentimes there's a lot of people I just help for free because there's just someone who just needed help. And, like, there's people that I'll just take on just because I'm like, they just didn't know any better any other way and wouldn't have access any other way. And so there's a lot of freedom there, and things can change and things can evolve, and you're allowed to pivot in the ways that you need. I think also with that type of freedom comes responsibility, like, on the other side of that, like, not overinflating and taking advantage of the fact that you can charge whatever you want to charge. But also, like, there's a client out there for everyone, right? So I think people will find their ways. they'll make their mistakes, they'll feel good about things, they'll feel bad about things, and you can evolve as you receive more information, you have more repetition, and then you have more data to work with to create a different output, just like anything else.
Yeah. So we talked a little bit about the SEO and trying to get people to find the athletic trainer.
Yes.
How do you explain athletic training to someone who has never met an athletic trainer?
I mean, that's the problem, right? That's an ongoing profession problem, right? How do I effectively communicate this? I mean, for me personally, I always explain to people that like athletic trainers are like orthopedic musculoskeletal specialists. So the most common problems you're going to see, if you have back pain, shoulder pain, knee pain, like athletic trainers are designed to work with these orthopedic related conditions. And I explain that people, that crosses a full spectrum of those injuries from the moment it happens to trying to rehab it to get you back to whatever it is you're trying to get to, and then the prevention aspect of it on the other side of it, and the return to sport. And so athletic trainers can cover a full spectrum of the orthopedic related conditions. And normally I also explain that, it's very similar to physical therapy, of course. Just physical therapy has a little bit different of a curriculum and an education to work with more niche conditions in the general population world. Like we're not working with like spinal cord injuries, right? Like you have a physical therapist that's specialized in that. But for when it comes to the majority of injuries that you see in sport, that's what an athletic trainer is best at.
Yeah. So obviously Concierge athletic training has been out in the wild for a little bit. It's not as maybe prominent, but do you think that this direct-to-consumer care could change the profession's future if this really catches fire?
Absolutely, yes. Because one, it's a consumer-based industry. So like anything in life, if a consumer wants it, they're going to find a way to get it. And so if we are good in that space, like if we're taking on our responsibility as a clinician to continue to evolve and learn how to serve people and help people and do our part as a clinician, then consumers are going to want to find us, and it's going to increase our demand, right? It's a simple supply and demand. And if people in the concierge space are willing to pay money, higher amounts, then you're going to pull athletic trainers away from the traditional employment models. And if you don't have the same supply, then those models are going to have to evolve or not, right? And if they're needing to retain the athletic trainers, they're going to increase their salaries in my belief system, in a simple supply and demand situation. If, we're doing our part though, as being service oriented and goal oriented, continuing to refine our skills, improve our skills, and offer something valuable to the consumer.
Do you think this could possibly help with the retention problem?
Absolutely. I mean, I personally can say I wouldn't be in athletic training if it wasn't for the many options I had within the profession. And I know that there's that's a very unpopular opinion with some spaces in athletic training, but like I was not happy in a lot of places. And because I had the option to pivot into a different community, but still build my skills as an athletic trainer, like that's why I'm here. And like that's what ultimately broke me off to starting my own thing and going into the concierge space, was because I've tried a lot of different things now. I've been in traditional sport, I've been in performing arts, I've worked domestically and internationally, I've worked in the high schools, in the clinics, in college level and professional level entertainment. And it's, like I needed something different again. Like I just needed to go off on my own and have creative liberties over who I am as a clinician. And so if I didn't have the option to do that, I probably would have gone into something else. So I think it gives people an opportunity to feel fulfilled and have agency over their profession and how they want to move through it.
Yeah. So with this platform opening more doors and options to athletic trainers and having to build your value through compensation, we didn't have a set number, obviously, but opening the eyes of how to build your hourly rate or whatever, however you're going to have somebody pay you.
Yeah.
Do you think this may help in the compensation debate that we've been having as a profession for a while now? Do you think it will help people educate themselves on what goes into creating, a compensation package or hourly rates and all that
Yes.
stuff?
Yeah, I think it's a little more nuanced than that, but yes. I mean, yes, in general, because you have to look at the compensation, like I said, the compensation package as a whole, right? Like, so obviously your hourly rate as a concierge athletic trainer is not going to be your hourly rate within a company, right? Because I can charge, and sometimes I can charge like $200 an hour for my services. Like, that's not going to be but what you're looking at is like you said, the compensation and the balance overall. Like, what is the overall picture? What is my incentive to go be an employee for someone instead of maintaining my own liberties as a clinician? And so when we look at the quality of the work-life balance, the quality of your insurance, your like all those normal benefits, like what are they offering that's going to give me an incentive to take me away from how much I'm making in this concierge space? Because I know in some system, like I can make this much money as a concierge athletic trainer, but that doesn't come easy either, right? Like I don't know where my money's coming from every day. That's very stressful. Like, so
Yeah.
there's, so like, but at the same time, I can choose who I work with, when I want to work with them, when I want to go on vacation. I can plan these other things, so you find, and it's different for each person. So it gives the individual agency over their choices in that. So where if they do end up going back to a traditional employment model, you accept, like, I accept that this is a lower price or potentially lower than what I make, because now, I've accepted the benefits, these other incentives that come along with it. So I just think it gives a little bit more, I don't like the word control, but I guess, like I said, agency over like what are you willing to accept for your life and your choices and your employment model, basically.
Yeah. Yeah. What safety nets are you willing to keep? And, like you said,
Yes.
the flexible schedule or the rigid overwork schedule, but you definitely have medical insurance and a 401k,
Yes.
or you're just making the straight cash, but you have to manage it. It's your business. And I think that's one of the debates I've keep trying to have with people is, yeah, it's a little bit low paying, but you have a lot of securities in place where, it's expensive to employ an employee. And I
Yes.
don't think a lot of people realize that. So, of course, if you
Yes.
go off on your own, you're responsible for everything and it gets very expensive.
Yes.
So, it's, yeah, trying to be grateful for what you're being given. Obviously, yes, the salary could increase and we could be respected a little bit more for being medical professionals, but,
Yeah.
what are you willing to give up to be
Yes.
able to
I say this
achieve
all the
what you
time.
want?
Everything in life is a trade-off, right? Like there's no perfect
Yeah.
system, no perfect solution. Like everything's a trade-off. And I think the beauty of the concierge space is it gives you freedom to evolve as you evolve as a person, right? Like, because we're not the same. Who we were 10 years ago is not who we are now. It's not who we're going to be 10 years from now. And if you're in the concierge at space, at least you can try to create the life that you're looking for, or it gives you an understanding of what you're willing to accept going back to a traditional employment model. So,
Yeah. So you had mentioned about making sure this platform keeps free for access to both the patient and the athletic trainer.
yeah.
What does success look like for this platform? What are you envisioning it to grow
Yeah.
into? And what do you feel like you'll be able to measure as success?
Yeah. Well, currently it's just the United States. I would like for this to grow internationally, of course. I can't take on too much too fast, and just from a liability standpoint, I need to understand what I'm getting into, and so I felt like starting with the United States is the starting point. I would like to see it grow, though. I would like to see an international presence for athletic trainers. I'd like to see an international presence for these athletes to have access, because athletes and performers, like, everyone's traveling. Like, the world is wide open these days, and you need access where you need access. And I think that's very important. It is important to me. I want to see it head that direction. I'm just simply not there yet, right? It's been 1 week. I would like to be able to monetize on the site, of course, but I would like to not have to monetize through charging people. Like, I'd like to be able to develop partnerships or some sort of ways to continue to promote, because there's other aspects of what we do, right? Other things that we need as concierge athletic trainers, like, and as clients too, like different recovery modalities and things like this. So I think there's opportunity to monetize on the site, because I have spent money on the site. Like, it costs money to build a website. It costs money to have a lawyer review the website. I would objectively like to get a return on my investment in this. So I do think a goal of mine is to monetize in a way that I can retain the free registration for the client user and the athletic trainer user. And I'd also like to be able to develop, keeping this right now as a concierge athletic training network, and specifically for an athletic trainer. Like, you have to be a licensed athletic trainer to be on the site. You can be dual credentialed in something else, but you have to at least be an athletic trainer. Was an intentional choice at the moment, because I think it's important for the advocacy and visibility of our profession. Obviously, though, athletic trainers are not the only resource in what we do, right? Physical therapists offer so much value. Chiropractors offer so much value. Like, every profession is important in that model. I would like to find ways to build out some sort of relationship with these other industries, because it's important. Right now, it was simply because of the athletic training advocacy component that I felt like keeping it athletic trainers for the moment is important, but that's also a direction I would like to see it grow into.
Yeah, definitely. No, that's where my mind kind of went, was like, well, there's some specialties, like the acupuncture or something specific, but I think we still provide a better menu of everything that somebody would want if you showed up and was working with them. But I get it. Well, was there anything else we wanted to touch on while I have you here?
I don't think so, no. Thank you for all your questions. I really appreciate you taking the time to explore this and be interested in it. It means a lot to me to have the interest there, so I appreciate it.
Yeah, definitely. Yeah, I think this is a great platform, and I'm super interested on where it goes and what type of people you bring together. Now you need like little summaries of the patient experience and how good it was to start pushing what athletic trainers can do.
Yeah, I'm open. I'm open to all possibilities of how it can evolve. And the messages I've received, some of them have actually been very helpful, just from like, first of all, like making sure things work on the website. There was like, oh, this one link wasn't working, those things. But also, people have really good ideas, and I've had like good interest in it. So I'm open to seeing what happens, and I'm excited for it.
Perfect. Well, I'm hoping to have you. I'll give you a little bit more time than just a week. So next week we won't meet, but a month.
Perfect.
We'll meet and get an update. How about that?
I like it. Sounds good. Hopefully it's grown.
Well, whenever you have more when you get more information, let me know, and we'll have you on to give an update on how things are going.
Love that. Awesome.
Perfect. Well, thank you so much for being on.
Yes, thank you so much for having me. I appreciate it.
That's it for today's episode of To the Bone. I hope we've sparked some new thoughts, challenged your perspectives, or simply reminded you to dig a little deeper. Remember, life isn't just about what's on the surface. Sometimes you've got to cut deeper and get to the bone of what really matters. To the Bone podcast is a product of Daily LLC. It's hosted and produced by Shelby Daly, ATC, and Randy Daly. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. For more on the show, visit www.tothebonepodcast.com. If you enjoyed this episode, be sure to subscribe, rate, and leave a review. Get involved in the conversation. You can find us at www.tothebonepodcast.com. Drop us topic suggestions or be a potential guest. We're all about connecting with you, our listeners. Until next time, stay curious, stay grounded, and keep cutting deep.